Coming right up, Straight Talk with Art Levine. Our guest tonight, Dr. Gaynor Pillsbury, Chief Medical Officer of Long Beach Memorial Medical Center, discussing the new healthcare legislation.
Opinions expressed in the following program do not necessarily reflect the views of Charter Communications nor its sponsors. We recognize our obligation to present opposing points of view by responsible spokespersons. For information, please contact the director of program.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner, called Old Glory. Let us join our fellow man. History will write the story. America will always stand.
Straight Talk is brought to you in part by Southern California Edison. For over 100 years, life powered by Edison. The Press Telegram, your local news leader for over 100 years. And Long Beach Magazine. Coastal Living, City Style.
Join us for tonight's edition of Straight Talk. And now your host, Art Levine.
Good evening and welcome to Straight Talk. We're delighted you're with us tonight. We're very honored to have as our guest for the entire show this evening the Chief Medical Officer of Long Beach Memorial Medical Center, Dr. Gaynor Pillsbury. Doctor, welcome to our show.
Thank you.
Doctor is a graduate of Poly High here in Long Beach and went on to Stanford University and then Stanford Medical School. And as the Chief Medical Officer of the largest hospital in town, we're delighted to have Dr. Pillsbury with us to discuss the new healthcare legislation, which is a lot of controversy throughout the country, really. Mm-hmm. But you've stated that, in your view, the system we have had has been dysfunctional and unsustainable. Tell us why.
Well, that's correct. And I think that perhaps before doing that, I could show you some slides about where we have been. I think there's a story of a traveler who pulls up to a farmer and asks him how to get to a certain town. And the farmer says, well, if I'd been you, I wouldn't have tried to get there from here.
I heard the main version, you can't get there from here.
But here is where we are with healthcare. And so let's show that first comment about how people are insured
okay,
in our country.
Under the current system, we have 61% of the population are insured through their employer. We have a growing number of uninsured, and we have 45 million enrolled in Medicare. And this chart, which the doctor has been good enough to bring, shows exactly that. That big green thing there is insurance through the employer, which is slipping, and a growing number of uninsured. Would you agree, doctor?
Yes, that's correct. And actually, the insurance by employer is kind of unique in the world. Other countries don't do that, and that actually is a result of World War II. Because during World War II, actually, there was a price freeze and a salary freeze, but there was no freeze on benefits. So the unions actually negotiated very rich benefit packages for their employees who were abundantly employed in the war effort. And these kind of continued. That's how all this great growth of healthcare insurance started. Now, some of that insurance in those days was completely comprehensive, covering first dollar coverage from office visits and so
And
forth.
employees got used to
And they
this
got used
rather
to this.
rich coverage.
They got used to this, and they resented it when they were now their co-pays and deductibles.
And of course, with the meltdown, people are losing their jobs and often their health insurance. So it's a big problem. Let's take a look at.
Before we get to that, let me just go through the other two parts, because in 1964 it was identified there were two groups of our citizens that weren't covered adequately. One was the elderly, and one was actually the poor people.
Poor,
And so that's when Medicare and Medicaid were passed by the federal government. And some of the rankling that's gone on with the new health care laws reminds me of the days of Medicare. And my father was I joined my father in practice in 1964, and he was a very conservative kind of guy. And he said, Gain, he says, if we have Medicare, it's going to be socialized medicine.
Yeah.
Doctors were refusing to join up, and hospitals were refusing to join up. That's become a very popular program. It's added 5 years of life to people, or mostly over 65, and hospitals now depend on it.
Okay, this next chart shows how health costs have increased as a percent of GNP, and the bottom line is the cost of health costs. The red line is GNP growth, and the top line is the percent, which is now up to almost 17%. So we in America spend almost 17% of our gross domestic product on health care. How does that compare to other countries?
Well, it actually calculates out to about $6,000 per man, woman, and child. And if you use Medicare, it's a lot more than that. And that compares to other countries that cover everybody for about approximately less, most of them are more than $4,000 per person.
So
per
we
year.
are spending more, and yet we have big gaps, as you pointed out, of poor not being covered and others.
That's exactly right. Now, the reason for that, why is it so expensive in this country? Well, it's for a number of reasons, but actually part of it is our fee-for-service, plans.
Yes.
Where actually doctors and hospitals are paid for doing things, for procedures, not necessarily for outcomes. And as a matter of fact, we pay so much, everybody thinks that newer is better and more is better. But in fact, some estimates, as much as 30% of these tests and procedures are unnecessary. And some may even unnecessary and may even be harmful. So we've got to get a handle on this, and it's become extremely complex. There's been a lot of medical knowledge in the last 40 years. There are now over 13,000 different diagnoses, over 6,000 drugs, 4,000 procedures, and how in the world does a doctor figure out the best thing to do? Now, doctors actually want to do the best for themselves.
But the system pushes them in some wrong directions.
Well, they're misguided directions. It turns out that somebody did a study of the variation of medical treatments. In 1999, Dr. Wenberg from Dartmouth did this study using Medicare data and found that when there's good science about treatments, like the treatment of fractured hips and colon cancer, everybody does it the same throughout the country. But where there's not good science, like in back pain and even chest pain, it's treated tremendously differently and with not improved outcomes. They even they studied then the expense of taking care of Medicare patients in different parts of the country and find that the difference...
Big variation.
Big variations, you see.
Okay, we're going to be continuing the discussion. We'll be right back after these messages. Stay with us.